Hello everyone. Today we will be talking about Green Top guideline number 52, which is about the PPH. Okay, so we'll start from the definition. What is PPH? PPH is the bleeding from the genital tract after delivery of the baby. Okay, so after the delivery of the baby, when bleeding from the genital tract occur, we'll label it as a PPH. How much bleed? 500 ml, more than 500 ml in cases of SVDs, and more than 1000 ml in cases of cesarean section. Okay, in this guideline we'll mainly when we are discussing PPH, we'll be mainly talking about SVDs. Okay, then the PPH we have divided into two types: primary PPH and secondary PPH. Okay, this guideline mainly covers the primary PPH, but at the end we'll also be talking about secondary PPH a little bit. Okay, so the primary PPH is when the bleeding occur from the genital tract within 24 hours of the delivery. Okay, 24 hours of the delivery when bleeding occur, we'll label it as a primary PPH. Secondary PPH occurs when bleeding occurs between 24 hours to 12 weeks of the delivery. Okay, the primary PPH we have mainly divided into two further subtypes. One is minor and one is major. Okay, when we will call it minor when the bleeding is between 500 to 1000 ml, and the major we have divided in further two types: severe, moderate. Okay, so the severe PPH is when the bleed is between 1000 ml to 2000 ml, and the moderate bleed is where the bleeding is between 1000 ml to 2000 ml, and severe is when bleeding is more than 2000 ml. Okay, when severe is when the bleed is more than 2000 ml, and moderate is when the bleed is between 100 to 1000 to 2000 ml, and minor is when the bleed is between 500 to 1000 ml. Then there are some points which I would like to mention, that the PPH is the most common cause of obstetrical hemorrhages. Okay, most common cause of obstetrical hemorrhages is PPH, and PPH is second leading cause of the direct maternal mortality. Keep these 2 points in your mind because they are very important from the MCQ's point of view. Now, what are risks and prevention? Okay, the identification of risk factors either antenatally or intrapartum. Okay, very important, because if we know about the risk factor, we can decide the place of the delivery. We can also decide on preventive measure we should take during the delivery or antenatally to prevent the PPH. If any risk factor is present, the delivery should be where? In a hospital setting where blood bank is available. Okay, now what are these risk factors? So remember 4 T's. Okay, what are these 4 T's? The 4 T's are: number 1, tone, which is most common and most important one. Second is tissue. third is trauma, and the fourth one is thrombin. Okay. What is the most common cause of the PPH? Tone. Most common cause.